A stroke is a medical emergency. It happens when blood flow to a part of the brain is cut off. Without blood, brain cells start to die. This can cause lasting damage. It is important to get help quickly. There are different types of strokes. They can be caused by a blockage or bleeding in the brain. Some people may have a warning stroke called a TIA. Each type needs different treatments. Strokes are serious and need immediate care. The faster someone gets treatment, the better their chances. Knowing the signs can save lives. Recognizing a stroke early is key. Quick action can reduce brain damage. It can also improve recovery chances. Ischemic stroke is the most common type. It happens when a blood vessel to the brain is blocked. This can be due to a blood clot. Clots can form in the brain or travel from other parts of the body. There are two main kinds of ischemic strokes. One is thrombotic stroke. It occurs when a clot forms in a brain artery. The other is embolic stroke. This happens when a clot travels to the brain from another part of the body. Ischemic strokes can cause severe damage. They can happen suddenly. Quick treatment can help reduce the impact. Medications can sometimes dissolve clots if given in time. Knowing the risk factors can help prevent an ischemic stroke. High blood pressure, smoking, and high cholesterol are common risks. Healthy habits can lower the chances of a stroke. Hemorrhagic strokes happen when a blood vessel in the brain bursts. This causes bleeding in or around the brain. The bleeding puts pressure on brain cells. This can lead to damage and death of brain cells. There are two main types of hemorrhagic strokes. One is intracerebral hemorrhage. This is when a blood vessel inside the brain bursts. The other is subarachnoid hemorrhage. This is when there is bleeding in the space around the brain. High blood pressure is a common cause of hemorrhagic stroke. Other causes include aneurysms and head injuries. These strokes are less common than ischemic strokes but can be more deadly. Immediate medical care is crucial. Treatment may include surgery to stop the bleeding. Medications can help control blood pressure and prevent more bleeding. Quick action can save lives and improve outcomes. A transient ischemic attack, TIA, is also called a mini-stroke. It happens when blood flow to a part of the brain is briefly blocked. Symptoms are similar to a stroke but last only a few minutes to hours. TIAs do not cause permanent damage. TIAs are serious warning signs. They can signal a higher risk of having a full-blown stroke. People who have had a TIA should see a doctor immediately. Early treatment can help prevent a future stroke. Common symptoms of a TIA include sudden weakness or numbness, especially on one side of the body. Other signs are confusion, trouble speaking, and dizziness. Recognizing these symptoms can help get quick medical care. Preventing TIAs involves managing risk factors. High blood pressure, smoking, and diabetes are key risks. Lifestyle changes and medications can reduce the risk of a TIA and future strokes. Section 5. Common causes of stroke. Several factors can cause a stroke. High blood pressure is the leading cause. It can damage blood vessels and make them more likely to burst or get blocked. Managing blood pressure can lower stroke risk. Smoking is another major cause. It damages blood vessels and raises blood pressure. Quitting smoking can greatly reduce the risk of stroke. It also improves overall health. Obesity is also a risk factor. Extra weight can lead to high blood pressure and diabetes. Both conditions increase the risk of stroke. Maintaining a healthy weight through diet and exercise is important. Other causes include high cholesterol, diabetes, and heart disease. These conditions can lead to blockages in the arteries. Regular checkups and healthy living can help manage these risks. Early detection and treatment of these conditions can prevent strokes. Section 6. Recognizing stroke symptoms. Recognizing stroke symptoms quickly is crucial. Sudden numbness or weakness, especially on one side of the body, is a common sign. This can affect the face, arm, or leg. Seeing a droop in the face is often a key indicator. Confusion and trouble speaking are also symptoms. A person may have trouble understanding what others are saying. They might slur their words or be unable to speak at all. These symptoms happen suddenly and require immediate attention. Other signs include trouble seeing in one or both eyes. A person might have blurred vision or see double. Sudden trouble walking, dizziness, or loss of balance are also common. These signs should not be ignored. If you suspect someone is having a stroke, act fast. FAST stands for face, arms, speech, and time. Check if the face droops, if one arm drifts down, if speech is slurred, and note the time. Call emergency services immediately. Section 7. Diagnostic procedures for stroke. Diagnosing a stroke quickly is essential. Doctors use several methods to find out if someone is having a stroke. A common test is a CT scan. This imaging test can show if there is bleeding in the brain. Another important test is an MRI. This test uses magnets and radio waves to create images of the brain. It can show areas of the brain that may be damaged by a stroke. MRIs can sometimes detect strokes that CT scans miss. Doctors also perform blood tests. These tests can check for conditions that might cause a stroke. Blood tests can reveal high cholesterol, blood sugar levels, and clotting issues. These factors can help doctors decide on the best treatment. Other tests include angiograms and ultrasounds. Angiograms use dye and X-rays to see blood flow in the arteries. Ultrasounds use sound waves to check blood flow in the neck and brain. These tests help doctors understand the cause of the stroke. Section 8. Treatment options for stroke. Treating a stroke quickly can save lives. The type of treatment depends on the kind of stroke. For ischemic strokes, doctors often use clot-busting drugs. These medications can dissolve clots and restore blood flow to the brain. Another treatment is mechanical thrombectomy. This is a procedure where doctors remove the clot using a device. It is most effective when done within hours of the stroke. Quick action is critical for this treatment. For hemorrhagic strokes, treatment focuses on stopping the bleeding. Surgery may be needed to repair blood vessels or remove blood. Medications can help control blood pressure and reduce swelling in the brain. Rehabilitation is also an important part of treatment. It helps people recover lost skills and learn new ways to do things. Physical therapy, speech therapy, and occupational therapy are common. These therapies support recovery and improve quality of life. Section 9. The role of medication in stroke management. Medications play a key role in managing strokes. Blood thinners are often used to prevent future clots. These drugs can help reduce the risk of another stroke. Common blood thinners include aspirin and warfarin. For ischemic strokes, clot-busting drugs can be life-saving. These drugs work best when given within a few hours of stroke symptoms. They help dissolve the clot and restore blood flow to the brain. Quick treatment is essential. High blood pressure medications are also important. Controlling blood pressure can prevent both ischemic and hemorrhagic strokes. Doctors may prescribe drugs like ACE inhibitors or beta blockers to manage blood pressure. Cholesterol-lowering drugs can help reduce stroke risk. Statins are a common type of these drugs. They help lower bad cholesterol levels and prevent blockages in the arteries. Taking medications as prescribed is key to managing stroke risk. Section 10. Lifestyle changes to prevent stroke. Lifestyle changes can greatly reduce the risk of a stroke. Eating a healthy diet is important. Foods low in saturated fats and cholesterol help keep arteries clear. Fruits, vegetables, and whole grains are good choices. Regular exercise is also key. It helps maintain a healthy weight and lowers blood pressure. Even moderate activities like walking can make a difference. Aim for at least 30 minutes of exercise most days of the week. Quitting smoking is one of the best things you can do. Smoking damages blood vessels and raises blood pressure. Stopping smoking reduces stroke risk and improves overall health. There are many resources to help quit smoking. Managing stress is also important. Chronic stress can raise blood pressure and increase stroke risk. Techniques like deep breathing, meditation, and yoga can help manage stress. Finding healthy ways to relax can improve health and well-being. Section 11. The importance of early detection and treatment. Early detection and treatment of a stroke are crucial. Recognizing the signs and acting quickly can save lives. Immediate medical care can reduce brain damage and improve recovery chances. Knowing the fast signs is essential. Getting to the hospital quickly allows for prompt treatment. Clot-busting drugs and other treatments are most effective when given early. Quick action can make a big difference in outcomes. Delays can lead to more severe damage. Preventing a stroke is also important. Managing risk factors like high blood pressure, smoking, and obesity can lower the risk. Regular checkups and a healthy lifestyle can help prevent strokes. Awareness and prevention are key. In summary, strokes are medical emergencies that require immediate attention. Understanding the types, causes, and symptoms can help in recognizing and preventing strokes. Early detection and treatment are vital for the best outcomes. Stay informed and take action to protect your health.